So knowing your work is getting a plan, getting all the information for your plan. So we do a lot of digital photography, as you can see. As we talked about this morning, it may be really important to get a CBCT, an MRI, and airway assessment for these patients, because if we can't predict where the joint space is, where that joint capsule is, what he's going to do at nighttime when he's sleeping, that will all affect our treatment. So just showing a couple videos of some of the tools that you can use digitally. So you can capture this information analog, right? You can get some alginate impressions, you can get some study models, you can mount them on a classic articulator, or you can do some of these things. I believe ModJaw is at the vendor, so you can check that out. That's also using photogrammetry. Some people might not realize that, but it's actually doing a recording of the jaw, so that's that lower video right there. This is me using a Trios intraoral scanner, and you can do some smile design, as you can see up there, using that actual scanner and design software. This is a newer smile design software that I had the privilege of playing around with when I was in Romania recently. This will be coming to the US soon. But it's a smile design software that uses a special biometric design based on the way you select it in the face. So it gives us much more realistic designs for teeth, not just this perfect Beverly Hills smile. So I have a lot of patients that want a very nuanced, very custom smile. And so I think this is a great thing we can use for our patients. It also allows us much better treatment planning. So the way that you move these little buttons around the teeth help you predict if you can have predictable soft tissue grafting around some of these crowns and veneers. So great for smaller cases as well. So know your work. Figure out a plan. We talked to Thomas about his desires. He wants something fixed. He wants it to stay in place. So I know which direction I'm going to go with him. So now I'm going to sit down with him. Our whole team is going to sit down with him and talk about the process and talk about the follow-up, because we want to make sure he definitely knows what he's getting himself into. And when I say a team, we have a person that interviews him from the beginning, that follows him through the care, and then helps with that home care instruction at the end.